This segment of DelmarvaLife is sponsored by TidalHealth.
Battling chronic illnesses means more than frequent doctor visits and medication. It might not come to mind first, but one of the best ways to alleviate the symptoms of chronic disease is regular physical activity.
Exercise bestows significant benefits for everyone, but for those going through pulmonary rehabilitation, now it's a vital key to recovery. So joining us this afternoon to explain more, this is Dr. Chris Evans. He's the Director of Cardiovascular, Pulmonary Rehabilitation, and Preventative Cardiology. Could you get any more bigger words in your title?
I took a couple out.
Oh, okay.
Oh,
Well, I
good,
appreciate that. Thank you. Okay, so let me just go straight to the chase here. What kind of chronic illnesses can exercise help?
So exercise can help a lot of chronic illnesses. Some of the main ones that we deal with, we're talking about pulmonary rehab, we deal with cardiovascular disease as well as pulmonary disease. Those are kind of the big ones that we deal with. Yeah. But within those, there's other diseases, diabetes, hypertension, high blood pressure,
right,
high cholesterol, things like that. So what we're doing is we're dealing with exercise, and a lot of those things that exercise brings is going to help with those chronic diseases, help prevent them and treat them as well.
Yeah, and I mean, physical activity in general is very beneficial. Can you talk about why and how?
Absolutely. Exercise can help improve your cardiovascular and respiratory efficiency, so essentially making your heart work better, more efficient, same thing as your lungs, making them work better, more efficient as well.
So I've got this, I'm diabetic, I've got high blood pressure, exercise is going to help me. Will exercise help prevent me getting to this point?
There's risk factors that you can't control. Unfortunately, as you get older, you're going to be at more risk. Family history, if your family has a history of cardiac disease, unfortunately, that's going to put you at a higher risk. So there are things that you don't have control, but what we do is we focus on the things that you can control. So those set risk factors, blood pressure, we want to worry about lowering those. Your cholesterol, we want to worry about keeping those low as well. Being active, there's research out there showing that sitting is just as bad as some of these risk factors as smoking and having high blood pressure. So not being physically active.
That's why I have my stand-up desk.
Exactly,
right.
yes.
So let's talk about the different rehab programs that TidalHealth offers.
So we do have different rehab programs. Like I said, our main focus is the cardiovascular rehabilitation, and we also have the pulmonary rehabilitation. Kind of the focus is after somebody's had a recent event, a heart attack, heart surgery. When you have an event like that, you're a little nervous about what you can and can't do. So we want to encourage them to be a little bit more confident in their body, what they can do. Right. We also hit a lot of education as well. We want them to be educated on what cardiovascular disease is, what are those risk factors. Going forward, what do we need to do to try to prevent another event or something worse? We also have a cancer rehab program that we do. People that either are going through cancer treatments or have had cancer, we have a special program for them. And we also have a PAD program, peripheral artery disease. So people that have blockages in their legs, a lot of times that'll cause claudication or pain in their legs where they can't walk very far distances. So we have a program to help them as well.
So I think you mentioned it earlier, an adult fitness program?
We do have an adult fitness program. Some people used to know it as phase 3 cardiac or pulmonary rehab. We've kind of rebranded it because a lot of people think, I didn't have a cardiac event, I can't go to this adult fitness program. That's not true. Again, we want the whole community to be active and exercising, so this adult fitness program is for anybody. You don't have to have a cardiac or pulmonary disease. If you just want to exercise and have registered nurses, exercise physiologists there to help and assist you, that's what we're there for.
Wow. And I assume it's never too late to start.
Absolutely.
All right.
So.
That's good
anybody.
to know. Dr. Evans, thank you so much for coming in today. Good information from TidalHealth.
Thank you for having me.